one of the tests that midwives will often recommend a mom takes is the GBS test, or the Group B Strep test. Now, this test is checking for a specific type of bacteria in the rectum and vagina, and the way that you test for this is just by swabbing that area. Now, it's important to realize that in 10 to 20% of healthy women, this test will come back positive, and that is because it is a bacteria that is found in our environment. And in only 1% of cases will this bacteria actually transfer over to the baby and be detrimental for their health. If it does transfer to the baby, the risk is that your baby can develop sepsis, which is an infection in their whole body, and that can be something that's very detrimental to their health. But again, that only occurs in 1% of cases. The standard treatment for a positive GBS test is to either do antibiotics during pregnancy or during the labor. Now, studies have shown that the antibiotic treatment is actually most effective during labor rather than given during pregnancy. The range of time that's usually given for this test to be taken is usually from week 35 to 37 of the mom's pregnancy. Now, I strongly recommend that you try and do the test as late as possible. Try and get it, if you are going to do this test, do it around the week 37 mark. And that is because you are closer to labor and birth then, and so you can have a better idea of whether that bacteria is actually going to be present when you give birth or not. If you do the test around week 35, there's a chance that your body might still fight that bacteria and it might even be gone by the time that you reach labor and delivery. But if you have already done the test around week 35, I'd really encourage you to make an appointment with a naturopath or a Chinese herbalist to start putting some natural steps in place to fight that bacteria so that it doesn't have to be an issue when you give birth and go into labor. It's important to remember that with antibiotics, they do have an effect on the baby, and some of these effects can be serious. So really weigh up your risk versus reward when deciding how to handle GBS and whether you even want to do the test and then the treatment for it. But like I said, if you are going the antibiotic route, it's more effective to administer the antibiotic during labor than during pregnancy. So chat to your provider, chat to them about your risk of your pregnancy, all the factors being considered, chat to them about their flexibility with when you get the antibiotics, if you do get it, and do your own research. Chat to your care provider, but then really dive into the research and be your own advocate for your health and critically analyze what your options are and what you'd like to do with that.